Hey, Jordan Roots here. Today we're going to talk about cervical radiculopathy. So cervical radiculopathy is a clinical description of pain or neurological symptom resulting in any type of condition that comes from an irritation of the nerve in the cervical spine. So when a cervical spine root is trapped within two vertebrae, it causes pain, tingling, numbness, usually down the nerve's pathway within the upper extremity. So some signs and symptoms are typically cervical pain, um, weakness, numbness, tingling sensations down the hands and fingers, numbness traveling down the upper extremity, and usually if you move a certain direction, it's going to either make the pain better or worse. So to test for these types of symptoms, we use a Sperling's test, typically done by a doctor. It's done by putting compression upon the cervical vertebrae, and this will usually bring out the patient's symptoms. And if it's a positive test, the symptoms will become much worse. So to treat this, we usually do, depending on the severity, rest and activity modification, physical therapy, ice and heat therapy, pain medications, or even injections, or sometimes manual manipulation at a chiropractor or exercise prescription. So something that goes along with cervical radiculopathy is tech neck. Tech neck is an overuse syndrome involving the head, the neck, and the shoulders, usually resulting in a strain on the spine from a forward head position, although it's not usually always caused by a tech device. So some signs and symptoms are pain in the cervical spine and back. They can range from dull aches to really sharp stabbing pains. The pain can be in the neck, the shoulders. They can cause muscle spasms, and usually it's a neurological symptom from a pinched nerve. So some testing for this is the Mygenes test. It's a vertebral-basilar insufficiency test, which is basically a big long word for is the blood flowing between your vertebrae or is it being pinched? Another test is the Jackson's compression test, which is usually done by applying a slight amount of pressure to the cervical vertebrae, and this causes muscle entrapment pain. So to break things down, tech neck is caused by a posture maintained for a long period of time that is not good for the neck. Um, the average head weighs about 10 pounds. If you increase that direction or degree by 15 pounds, that head's going to go up to about 30 pounds. And if you increase that by looking way down, you're going to increase that pressure by a whole lot, and that's going to make your head seem like it's almost 60 pounds on your neck. So if this is left untreated, you're going to see things like on the right-hand side of this slide, you'll see a reduction in curvature, and the left-hand picture is a normal curve. So basically what happens is the curve in the neck reduces and you're going to get pinched nerves, you're going to get spinal degeneration, you could get misalignment, disc herniations, nerve damage, and muscle weakening. So we need to keep an eye on our necks. The average person communicates on a technical device for 3 or more hours a day. To alleviate some of these symptoms, we need to hold our phones at eye level, take a break from scrolling through Facebook and Instagram, and check your posture. Make sure you're not staring at your phone all day. So to treat this, we usually use postural correction, making sure everybody knows what their head's doing, some daily stretches, just to improve overall flexibility and strength, and a nice exercise prescription to overall improve strength and supporting muscles in the neck. So cervical radiculopathy, we did a case study on a 22-year-old female student that presented at a chiropractic office with radiating numbness and pain in the cervical vertebrae and down the right arm. The patient claims this has been going on for years and has not really had any success with any sort of physical therapy. She's used ibuprofen and a type of muscle relaxant gel. She also believes that this is due to overuse and not using any sorts of muscles that way. Also believes this is part of her migraines. So we talked about her family history. She's a normal, pretty healthy female, no major issues. She has an active range of motion in the upper extremity. The only thing that we saw actively was a reduced range of motion in the cervical spine due to muscle tightness and pain. So we have some x-rays from this patient. If you look at the one in the middle, you'll see a positive, obvious reduction in the cervical spine. The spine is supposed to be 40 degrees posterior, and this patient's cervical spine is 7 degrees anterior. You'll also see a mild scoliosis in the thoracic spine and just a hip misalignment also. So for this, we did some treatment, and the patient underwent 3 months of manual manipulation of the cervical, thoracic, and lower spine at a clinical chiropractic office. It was also accompanied by some massage therapy, trigger point massage in the trapezius and rhomboid muscles. The patient was also given a bunch of exercises and stretches to do at home and was advised to be mindful of when she's looking at her phone, looking down at a laptop, if you're just sitting at a table looking down, or even a sleeping position. If your head's not in a neutral position, this can cause more issues with the neck. So for some at-home treatment, we prescribed a couple exercises. We included the chicken neck, chin tucks, and the corner stretch. My favorite is the chin tuck. It's super simple. You can do it in the car, you can do it sitting in the library, you can do it sitting in class, even though that might look kind of funny. Chin tucks are just basically when you pull your chin in as far as you can as maintaining a neutral position, and then focus on holding that for about 30 seconds and a release. So the results of this case study were a reduction in the forward protrusion of the head by 1.5 degrees. So that was a gain in her cervical spine curvature. She had a reduction in pain in her trapezius muscles and rhomboid muscles. She also had a reduction in the amount of headaches and the severity of the migraines, which was something she was really, really looking forward to. She also increased in her range of motion and is expected to continue this treatment for 12 months or more if needed. So to make a last point, if you have ongoing pain in your neck, you want to consult a physician, if not a neurologist. It could be something minor, it could be something much more. You just want to make sure there's nothing going on. So just keep in mind that you're checking your posture throughout the day, that you're not staring at your phone for hours on end, or you're not staring at your laptop, that you're taking breaks from electronic devices. Just get up and walk around, look around the room, it doesn't really matter. And also remember to hold all of your electronic devices at eye level. This really helps to keep the spine in a neutral position and helps you to keep your eyes up so you're not looking down at that device. So I hope you enjoyed. Here are some references. I know it's kind of boring. Have a great day.